Hello everyone. This will be your last opportunity to adjust volume and focus settings before the presentation begins. Once we switch to the next slide, there will be a slight pause in case you are showing this in a group setting. Hello, my name is Deb Alt. I am a registered nurse and the president of Alt International Medical Management, but most people simply recognize me as Nurse Deb. I want to thank you for taking a few minutes to visit with me today to learn more about Alt International Medical Management and the added benefit that is now available to you as a part of your Consociate health plan. Let's begin. People will often ask me, Deb, when is a good time for me to call and talk with the nurses at AIMM? And to keep things simple, I tell them, anytime you have something more serious than a regular doctor's office visit, but less serious than calling 911, is a good time to call and talk with the nurses at AIMM. Our toll-free and confidential phone number is shown at the bottom of each of these slides. It is also shown on the back of your new insurance ID card. If you do have a situation where you require 911 assistance, once you are stable and settled, feel free to call and talk with the nurses at AIMM. As I mentioned earlier, we are a new, free, and confidential added component to your Consociate health plan. You now have a team of professional registered nurses and physicians available to assist you. We can help you with any health or insurance-related question. Our services are free, they are confidential. Just like when you call and talk to one of the nurses at your doctor's office, anything that you discuss with one of the nurses here at AIMM is held in strictest confidence. We are not here to tell you or your doctor what to do or what not to do. We will help you to make sure that you have all of the information, resources, support, and guidance that you require in order to work collaboratively with your physicians to make the best decisions for you. You now have a 24/7, 365, yes, even Christmas and Super Bowl Sunday, nurse on call. If you or someone covered by your health plan is ill and you need assistance to determine whether you should go to the emergency room or not, what comfort measures you can use until you're seen by a healthcare provider, and what emergency symptoms to watch for, that's a good time to call and speak with the nurse on call. We live person answer in the office during regular business hours. If you call outside of those hours, a computer will answer the phone and will walk you through some basic prompts. Please follow the prompts for I am a patient and the prompt for I am sick and need to speak with the nurse. That will put you through to the nurse on call. I'd like to point out that these are AIMM nurses taking rotation being on call. So just like a nurse who's on call to go into the operating room if an emergency arises, these nurses are out and about in the community with their family and operating just like they would if they were on call at a hospital. For that reason, when a nurse answers the phone, it's not unusual for her to ask you to please hold a moment while she gets to a private place so she can have her conversation with you. Additionally, these nurses cannot perform pre-certifications, answer questions about why you received a letter in the mail, or do any basic office-type work. Those calls will be returned the next business day. But if you are sick and you need the assistance of a nurse, please don't hesitate to call us. The toll-free phone number is shown on the bottom of this slide and on the back of your new insurance ID card. You also have the maternity management program now available to you. If you or someone covered by your health plan is currently pregnant or plans to become pregnant in the near future, please call and talk with the nurses at AIMM. In addition to a great packet of written information each trimester, conversational assessments conducted with the nurse will help you to determine if there are any risk factors that you need to discuss with your physician, and will make sure that you have all of the information that you need to have as healthy a pregnancy as is possible. This is also a good time to point out that it's not unusual for the nurses at AIMM to do outreach phone calls to patients based on a variety of trigger indications. If your doctor's office calls in to pre-certify your maternity care, you may receive one of those phone calls from a nurse. We do not leave detailed messages. You will get a call that says something along the lines of, "Hello, this is Nurse Deb from AIMM. I'm a part of your Consociate health plan. Please give me a call back. My toll-free number is. If you receive one of those phone calls, please rest assured we are not a telemarketer. We are not trying to sell you anything. But be aware, we do not call unless there is a reason to do so. So even if you do not think that you need the assistance of a nurse, please do us the courtesy of returning the phone call, and we can explain to you why we outreached to you and identify how we can best assist you. Pre-certification has been a part of your plan and probably always will be a part of your plan. The only difference now that you utilize the services of AIMM is that we encourage patients to do their own pre-certifications. In the past, you might have relied on your doctor's office or hospital to do these pre-certifications for you. And while that's okay, if they call, we'll definitely talk to them and gather as much information as we can and put it through the pre-certification process. I would encourage you as a patient to instead take on the responsibility of calling and talking with the nurses at AIMM yourself. Here's why. Often when a doctor's office calls, they will wait until the very last minute to do so. They'll call the morning of or the day before a procedure or service, and we understand why they do that. They want to make sure that they have all of the most current information about your health plan, deductibles, copays, and so forth. However, if the information that they provide is not enough information to result in a certification, they may want to delay your procedure while they get through that process. We don't ever want that to get in the way of you getting care that you need. So as soon as you know that you're going to have something more serious than a regular doctor's office visit, call the toll-free number listed on the bottom of this slide or the back of your insurance ID card. The process is simple. You need the patient's name, patient's date of birth, information about what is going to be done and where it is going to be done, as well as when they plan to do the procedure or service. We're used to talking with patients, so you don't have to be worried that you don't have all of the codes or technical information or big medical jargon. We'll help you through all of that. If, however, there is information that is needed that you do not have available, we will outreach to the doctor on your behalf and get that ball rolling sooner rather than later. I'd also like to point out that typically a doctor's office or a hospital has someone call who's trying to decipher the chicken scratch that the doctor left in the chart. That information is often incomplete or not thorough enough to complete the pre-certification process. In order to avoid a situation where something is not certified, it's best if you as the patient call. You know how long things have been going on, what caused them to start, what treatment has been done so far, what the doctor said during that appointment. So call yourself to the toll-free number shown on the bottom of this slide or the back of the insurance ID card, and the nurses at AIMM will walk you through the pre-certification process. Additionally, you now have case management services available. I hope that none of you ever require these services, but if you do, you have a lot of information from well-rounded, strong clinical nurses who can assist you. The way I tell our nurses to recognize if someone might need case management is this. If your best friend were to call you tonight and said that their spouse was just diagnosed with, you fill in the blank, and your reaction is, oh my gosh, that's someone who could probably benefit from case management. So any life-altering, catastrophic kind of condition, heart attack, stroke, multiple trauma, cystic fibrosis, spina bifida, cerebral palsy, children with congenital anomalies, chronic fatigue, lupus, fibromyalgia, any of those life-altering types of conditions. You now have a team of nurses who can assist you to navigate both the health and insurance systems. We can help you to identify resources not only within your health plan, but also within your community. Clinical trials that may be appropriate, pharmaceutical scholarship programs, other financial assistance programs that might be beneficial to you. So if you or someone who's covered by your health plan is currently in this kind of situation, please do call and talk with one of the nurses at AIMM as soon as possible. And again, remember, if we receive notification, whether that's through a claim that goes to your insurance or a pre-certification request, that you might be in a situation where you could benefit from working with a nurse, you may get a phone call from us. Please return that phone call. In summary, you have a new, free, and confidential benefit available as a part of your Consociate health plan. The team of professional registered nurses at AIMM are available to assist you with any health or insurance-related question. We hope that you will call and talk with us soon. Our toll-free number is shown on the bottom of this slide and on the back of your new insurance ID card. If you have anything more serious than a regular doctor's office visit, but less serious than calling 911, please call and talk with the nurses at AIMM. Thank you.